We are recording. On behalf of Access to Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health, welcome to a mindfulness experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The office educates health professionals and healthcare consumers about integrative medicine. Today, we have with us two very recognizable faces. I'm just going to use their first names like they're Madonna or Cher. So we have Misha, founder and executive director of AIM Health Institute, medical director of the GW Center for Integrative Medicine, author, speaker, all-around mensch. Next, we have Yael, who is a yoga therapist, Reiki Master Teacher, board certified Polarity Therapist, leadership coach, organizational facilitator, poet, and writer. All right, Misha, take it away.
Well, hi, everybody. Welcome to our Friday, you know the drill, questions first. We're kind of just gonna keep going for about 25 minutes, maybe half an hour. So yeah, how much time do you want? Half an hour is good?
Sure, I could 20 minutes or half an hour or whatever works.
Let's do half an hour. So I promise we're going to talk about long COVID. That's what we're going to talk about. I don't actually have any slides. I kind of decided probably better off if it's kind of a free-flowing conversation with a lot of Q&A. So I'm actually going to, if you put the questions, but I'm going to start talking about long COVID. So first, kind of an update. We are now about 6 to 8 weeks into doing our group. It's going pretty well. We're adding at least a couple of patients per week. So we've grown very quickly. So now we're going to add in the next week or two, we're going to add the second group. And we actually decided to change the whole flow. Instead of having a preset curriculum, it sounds like everybody on kind of different, want a different flow. So we're just simply going to do 2 hours a week to 2 1-hour offerings. Seems like that's going to work better, and basically just talk about whatever's going on with patients and anything specifically new and updated in long COVID. What I specifically want to cover right now is two things. I want to talk about chronic fatigue because this is by far the most common symptom that everybody having. And then I think the second symptom I want to talk about this kind of a general autonomic dysregulation, which is also very common. We did a lot of sleep issues before. They're very frequent, but it's kind of similar to everything we discussed previously. So with a fatigue, it's a different type of fatigue with long COVID. It's not your usual kind of, I am not sleeping well, I'm tired, or I exercised a lot the day before and now I'm tired. It's kind of just a deep exhaustion. And it often goes together hand in hand with this autonomic instability when patients would say, I tried to walk a block and then I just can't even move. Like I'm so exhausted, I barely walked that block. And now I'm more exhausted after moving. So usually when you're talking about general garden variety of fatigability, people feel better after exercise. In a lot of patients with long COVID, we see the opposite. They get worse after any exercise. It is sort of similar with a severe fibromyalgia and chronic fatigue syndrome. The difference is, though, I think overall level of severity appears to be higher, especially in patients who've had chronic fatigue as a primary first symptom. Why that is, I am not exactly sure. I think a lot of this is still TBD, and it's going to be more specific on exactly what we're looking at. I do have one very clear sense, which is, I think in case of post-COVID, the biggest issue in chronic fatigue is actually not hormonal, but more of an oxidative stress. So patients simply have an overload of the dirt in their mitochondria and they can't make enough energy. And so what I have seen increasingly being effective are the things that tend to clear up the junk. So those are some of them we talked about. So things like glutathione is good. Things like molecules that support or boost an energy production. So particularly it's NAD+, which has to be given intravenously. If somebody told you can try to do it sublingually or topically, it's not true. It's too unstable. But there are molecules that are similar to NAD+, but not the same. So it's called NMN and NR, nicotinamide mononucleotide and nicotinamide riboside. So those are precursors to NAD. They have to be converted, but assuming machinery is operating the Krebs cycle, relatively speaking, even if some parts of the path or the cycle are gunged up, then it's still going to work. In fact, let me show you actually what I'm talking about. I think that would be useful. I'm going to bring up the test that I use a lot. This is going to be just a sample. It's not anybody particularly. I'm just going to go to the Genova website and pull it up. Okay. All right. So this is the test itself. Again, I don't know if it's just a sample test. So what I really want to show you is this part. So the test analyzes every step of enzymatic activity. And when you get to this succinic acid, the step right before this conversion of alpha-ketoglutaric acid to succinic acid is when an ADH and FADH are made. So the liquid energy molecule, what we call, which is NAD+, can be infused directly. And it is occasionally done. It's very expensive and actually works best really for kind of a severe acute withdrawals, either from alcohol or from heroin or from anything, actually, even from medications. Like I've done it a couple of times on patients who had a horrendous benzodiazepine withdrawal to help. But so the other molecules, like, for example, nicotinamide riboside on NMN that I mentioned, they will just come right here. So they will be the precursor that then have to be converted by this enzymatic step right here. And so you also have to have all these cofactors for this to work. So that seems to be something that helps for at least some patients with long COVID fatigue. I think if Ashley were here, she would more than agree that variety of different acupuncture techniques, particularly Moxa. Moxa is a warming of a point on top of it, and in the class we actually we taught patients to do their own Moxa. You can buy this smokeless stick on Amazon for something like $10, and then just hover the heated stick right over the acupuncture spot. Of course, don't ask me which points. I don't do that, but Ashley went over that. So at some point, if there is a significant interest, I think we can ask Ashley to do so. Of course, I don't know how I feel everybody getting a Moxa sticks and sitting there in the house with her showing everybody how to burn it and how to stick it over this. We may be asking for too much trouble here, but that's what literally was done in the group. And you can also use acupressure. So there are protocols where acupressure is used to kind of jumpstart the system to clearing of the junk. So that. Now, people always ask me the following. So we always told we need to exercise to get fatigue improved. So it's a little tricky here. So if you're talking about any other type of fatigue, cancer fatigue, any garden variety fatigue, otherwise, that will be the first thing to say. Definitely exercise. Problem with what we're seeing with COVID, it actually makes things worse. So you really have to be very careful. The general recommendation is if you self-tried and you're getting worse after you exercise, you need to find someone who knows what they're doing, either a physical therapist or somebody like Mikhail, who really that's what they do for a living, right? So outside of that, if fatigability causes this symptom, then you really don't want to, if exercise does it, then you really need to be careful. I don't know why is this weird. Getting something going on here with my mic. Can you hear me okay? Okay, I don't know why, but my mic.
Yes, we can.
Okay, my mic got disconnected, my main mic. So now I'm operating off of the,
You actually sound better now to me.
really?
I don't know about to others. Yeah.
Well, I just switched to my computer mic. I have this professional grade that suddenly went offline, but okay. So that's fatigue. And the other things that can be tried are, of course, if you have not had a functional workup and you still have a fatigue, then that would be priority, because there are a lot of factors. I just showed you one where you really have to know the levels of functional levels of certain vitamins and nutrients. Otherwise, if you're functionally insufficient, the enzymatic activity is not going to go normal if you're lacking those cofactors. And then B vitamin, whole series of B vitamins, magnesium, and lots of other nutrients are essential in that. And again, it often doesn't mean that if you check the level in a serum that it's going to be useful. It actually could be completely useless, because the level could be totally normal, and yet you may have a horrendous insufficiency, and you'll never know, because you will be checked, your B12 level would be checked, and you will be told, oh, your B12 level is normal, you don't have to take any. The problem with that logic is that there's a difference between levels in the blood and what your body requires for function, for optimal function. And often those things are completely not the same. So that's a very important point to keep in mind. And then, so this whole idea of autonomic instability. So this comes at play heavily with COVID. Interestingly, with the prior versions of chronic fatigue syndrome, whether it's from mononucleosis or mold or Lyme or other things, there seems to be a lot less of that. So COVID seems to be kind of unique at this. I would estimate more than 50% of patients with long COVID have this. You hear the terms POTS. It's actually not necessarily appropriate to say that, because POTS is a more severe version of it. I think most of the patients don't actually have POTS. They just have some level of instability, and their blood pressure may not crash as much when they move, but they may still have certain, so that the heart rate can go up to some degree. They may just feel a little dizzy when they stand up. But the problem with all this is that it contributes significantly, not just to fatigue, but for the entire system dysregulation and for general, even sleep, for example. And that is probably has more to do with the fact that COVID somehow directly impacts the autonomic nervous system, whether it's a direct viral impact or some kind of a long-term pro-oxidative stress that's particularly affecting nervous system. I don't think I can answer that. I don't know, maybe Mark read something more specific on that, but I don't have a good answer to that. But it's seemingly a clear phenomenon. And the more severe autonomic instability is, the sicker the patients are. And if I were to say that fatigue is universal, but fatigue is easily addressable, in my opinion, the autonomic instability is not. Predictability of who's going to respond well to that is much harder, and it's also lasts a lot longer. I have few patients who are fatigue is already completely resolved, but they're still get immediately fast heart rate the moment they try to exercise. They blood pressure crashes, and so they're not quite, and they're young. Like I have this one man, I'm thinking he's in 31 and avid exerciser before, completely healthy before COVID, and now a year and a half later he still has this. So he can exercise, but very, very limited capacity because of that, because any kind of a load on the system would not cause fatigue, but his heart rate just shoots up and he's just really feeling it. He's getting lightheaded, he's getting dizzy, he's feeling palpitations and can't do anything. And they tried beta blockers and they actually worked. They didn't work at all for him. Blockers are a class of medications which are very useful usually. So they slow the heart rate down. And so when the heart rate tries to go up, there's going to be a rapid block of that effect. And so if the issue is indeed just a fast heart rate, it should work. But in him, it's a bit more complicated. And now he's considering some very complex approaches. So there is basically a block. You can inject medication into the certain routes, into certain nerves. to block certain outputs. So it has to do with the fact that typically all these autonomic processes are innervated through the vagal system, through the vagus nerve, and you can block different parts of the vagus nerve to knock out particular dysregulation. Of course, it gets pretty tricky because you're going to have potentially some side effects with it. So that's that. Now I want to talk a little bit about the European approach. I haven't done too much research about what they do over there, but I found a couple of things that were fascinating. So for example, they routinely early on a lot more aggressive at blood thinning. And that goes not only to the acute COVID, it goes to chronic COVID. There is some level of belief that in chronic COVID, there is a micro clotting that occurs for everybody. I'm not sure if I 100% disagree with it, but that's an interesting concept. And I am rapidly increasing number of long COVID patients whom I'm suggesting to try either a baby aspirin or the natural blood thinners, which I usually use nattokinase, but there are several others like lumbar kinase is one. And the principle there is that basically if you're clotting on a periphery, not large arteries, but on capillaries and on areas that are a bit more distant, you can have a hemodynamic shifts that could explain a lot of symptoms. Clotting, of course, can be a catastrophic problem if you clot something large and then the blood flow stops. You can have a heart attack, stroke, you can have cold foot and whatever. So you can have a catastrophic consequences. That's not necessarily what we're talking about. We're talking about mostly microclotting. And so they do pretty advanced techniques in Europe. For example, plasmapheresis is a pretty common procedure. So it's basically like you can compare it to dialysis. When the blood is taken out, purified, certain things are removed and put back in. Except that here they it's not like it's going through the dialysis. They don't remove chemicals. They remove the certain particles that are specifically charged or specifically have specific attachments. So it's a little more. It's used for complex blood disorders usually to remove some antibodies or to remove some kind of immunogenic component from the blood if that immunogenic component is causing some problem like clotting, for example. So it's very expensive therapy. So I'm a little surprised to see that it's used on a lot of acute and long COVID patients. I'm not sure how Europe maintains that, but maybe what they do is they just have particular centers where that's utilized instead of kind of general approach. I do want to mention a couple of experiments we've been doing. So we've been doing infusions of intravenous vitamin C with some of our long COVID patients. I don't think I'm seeing a lot of magical results. There's some patients who've had some benefit, but not actually less than I expected. So I'm not exactly sure what will happen with that. I think with acute COVID, vitamin C has way better intravenous, way better logic and way better result. And we even have a Jefferson's trial to show some benefit. Now, on the other hand, the mistletoe is an interesting option, which we're starting to explore. I've heard few centers have reported some benefits from this approach. That's mostly what we use mistletoe in a clinic is for cancer patients, but it is definitely there. Mistletoe is an immune modulator, and it could be pretty potent if it's given intravenously. So if you're worried that particular patient has some kind of a post-COVID immunologic condition, mistletoe can make sense. But I think it's still premature. And last, I want to bring the whole point of cannabis for long COVID, which is what we discussed yesterday. I'm going to go ahead and put the link to what I discussed yesterday in the chat. This is directly off my YouTube. I think it's already uploaded. Okay, so yeah, it's already uploaded, and I'm going to put the link in the chat. So, but basically, as you would expect, I think I've talked about this before, you would expect cannabis and CBD for certain COVID-related symptoms being very effective. So insomnia, chronic pain, nausea. Nausea is very common. Patients who get autonomic instability very frequently get nauseous, and mechanism of that is if your vagal nervous system is dramatically affected, you can have this peripheral induced nausea effect, and also vestibular nausea, which is a little bit less common, but it still could be there. So, all right, I'm at 2:24. I'm not seeing any questions. I don't know if that means there are no questions, but I'm gonna just check in with you guys. Otherwise, I want to make sure we have time for questions before Yael goes in a couple of minutes. Very quiet crowd today. I don't know how to take that. I don't know what that means. Nobody has any questions, really? You guys don't have any questions about any, not what I just said. Okay, fine, but no questions about what's going on? Nobody is interested about XBB, the new terrible variant? I don't have any updates on it, so I can't answer any question anyway. I haven't seen anything since last week. I told you I will be looking. I couldn't find anything new and interesting. There's a lot of concerns, but there's seemingly more of just concerns. There hasn't been any movement towards higher frequency of that strain. So honestly, I'm more concerned at the moment. I don't know if any of you have seen the most recent report by WHO and also by the kind of a leading consensus scientists on climate change. Now they're basically saying that's it. There is no more possibility to go back and reverse it. And now it's all about just trying to slow the shift down, but the anticipated changes in the weather are going to be catastrophic. And they're basically saying, forget trying to work on this. We need to start evacuating people from lots of parts of the world, expecting the massive complications there. And we need to start adapting to changes that will be continuously worsening. I find one thing that very interesting. They're actually blaming mostly oil industry on this problem, because there was an expectation that the oil industry self-regulate and will begin to shift toward alternative energy sources, but instead COVID increased consumption of fossil fuels. And the only thing that kind of a war in Ukraine, if you will, as a silver lining, that the world finally realized in developed world, we can't rely on fossil fuels. We have to shift to alternative. It has nothing to do with actually the climate change. They're basically realizing it's an unsustainable future effect. So they're going to have to start creating long-term energy reliance on the sustainable resources that will not be depending on some calamities in particular parts of the world. Okay, have you seen any data on degree of long COVID and immunization status? No, I have not. Good question, actually. I guess the key question is, well, there are two questions here. Is there a chance that vaccines protect or the opposite, or increase risk of long COVID? Yeah, Mark, it's a good question. I don't think such data exists, but probably somebody's trying to come up with this. If you see it, we should definitely discuss it. Yeah, Judy, you should say how great Ashley is in a long COVID group. Go ahead and unmute yourself.
I joined 2 weeks ago and I was so impressed with Ashley. She is really, as far as a facilitator, as good as I can recommend. She's warm, she's kind, she's knowledgeable. And I think probably the best thing about the group is I would consider it a really safe space for people to talk and share. And everyone is really understanding and compassionate with one another. And it's so wonderful to see such a nice collection of people who are willing to help each other out and support each other. But Ashley's just a star. So she's just terrific. And I can't rave enough about her. She's just really, really great. So you did a good job with that.
We'll have to make sure she will watch this at whatever the minute this is. Yeah, I want to echo that. She's a kind of a natural born group facilitator. It's actually not an easy skill. Like, I don't know. I don't do that very well, and I know that. So I'm not trying to pretend. So yeah. Yeah, and I actually felt that was one of the best things we came up with, because the group is the critical aspect of the group. We're not really teaching. I mean, we're teaching some didactics, but it's the group process that facilitates the healing. And we just, it's a profound component of the group. I mean, you're all coming here, and there is some of that here, but not to such a depth of the degree as in that hour specifically. All right. Well, I'm going to take another minute or two, because as I said, there are suddenly a couple of questions as usual, right before the end. Any specific recs on preventing long COVID? Same as, yeah, that's pretty much it. So, you know, we basically what I say is, when COVID hits acutely, you have to be very aggressive, not to treat the COVID itself. Nobody's, unless you're really immune compromised or have some underlying bad condition, you're not going to have probably at this point a very bad acute. It's what's going to happen, whether your chances of long COVID are higher. And from what I'm seeing, the typical package we've been discussing for the past, whatever, almost 2 years, is basically rather effective. We're seeing a lot less long COVID in our patients who we treat very aggressively with. You know, and whether Paxlovid decreasing risk of long COVID, there is some data that says no. And I'm not sure that's going to pan out or not, but I have read an article that basically says no, it kind of does not. Which would make sense, because the long COVID probably is not related to the just acuteness of the illness. It's probably related to the host innate response to the illness a lot more than how much virus you actually have in your system. That's the secondary, and you may have a little virus and still have a pretty prolonged response to it. So it's a bit more complex than, can you just block the viral replication within first 24 hours? Unfortunately, it's not that simple. Okay. And then the second, Linda's asking, do you know the latest booster was tracked through FDA and did not include any? No, there's now one small human trial that was published, I think, 2 weeks ago on like 45 patients, showing kind of a similar efficacy for the compared to, so showing non-inferiority against the older vaccine, but it's supposed to include the newer strains. So the older vaccine was not supposed to cover the newer strains as much as this new one. But it will give, even the old one will give some relative protection against severity of illness. It's just going to be even, neither prior or the current boosters, by the way, give block chances of getting COVID at all. Whether they even decreasing chances of getting COVID is not even clear. They're simply making disease a lot milder. So that's the biggest difference. All right, well, it's 2:32. Oh, Salome, is that a hand? And dear, you need to unmute yourself.
It just clicked in my head. Do all people who get COVID get longer COVID, or are there certain people?
No, only about 20%.
So
Somewhere between 10 to 30%, depending on what numbers you look at. And also depending on the age group, heavily. So the kids and young adults get a lot, well, no, kids and older adults get a lot less COVID, long COVID. It's seemingly that somewhere starting in late 20s and all the way up to probably 70, that's where the risk is highest.
Do we know why?
Well, presumably it's an presumably it's a disbalanced immune response to the virus that's causing kind of this chronicity of the persistent response, if you will. As the virus is long gone, but there's still a response. And we talked about a little bit about some mitochondrial health, energy production gets decreased. There's some other factors like hormonal dysregulations, autonomic instability, and others. So we know some aspects of it, but we don't know exactly what to do with all of them. It's seemingly a very challenging condition for the current system.
Okay, thank you.
Yeah. And with that, it's my pleasure to reintroduce again Yael to all of us. Well, of course, Yael's been here many times, and those of you who just somehow don't know, she's also a GW C-IAYT yoga teacher and biofeedback teacher, and you know, I don't know how many things she does, and our local poet and whatever. And if you need to learn
Rock star.
and if you need to learn some New York curse words, I highly recommend following her on the media. So with that, Yael, it's always a pleasure. Unfortunately, I have to run, so you guys, I'm gonna say goodbye until next Friday, because I'm teaching actually at another retreat at the same time. But you're in good hands. Everybody have a great weekend.
You too, Misha. Bye. All right, friends. So I'm so happy to be here with all of you. And I didn't like the idea that I came up with for this group. And so I reached out to Nadia and said, who's on the call today and is often on the calls on Friday, and said, I'm all ears. Do you have any suggestions? And so if you like what I do, you can thank her. And if you don't like what I'm going to do, you can blame me. That's the way that this always works. And it might fit very well with this idea of fatigue. Because what Nadia was saying was, do you have anything to relax the face and the jaw? And a lot of us just carry, without even realizing it, so much tension in the face and the jaw. Our vagal nerve goes through, which is the 10th cranial nerve, sort of like the brake pedal, just to actually calm down the autonomic nervous system, goes through most of the face and also the voice box. So doing this work, even though we're looking at tension specifically up here, it really can also take away tension throughout the entire body. Just like if you have like a hand massage or a foot massage, often the whole body will release. And so it's sort of like that. Also just very good for things like jaw pain. If you're someone who sort of continuously like kind of bites down or grinds your teeth, and also for headache or tension. So just a few guidelines. When we're going to be working a lot with mainly a soft touch, and it's self-massage, so you don't need anything other than your fingers. Although if you happen to have like a little oil or moisturizer, just so that when you're doing this, you don't drag at your face, that's great. I just have like a little homemade concoction from different oils right by me. So if you have something, that's great, but you also don't need it. Pretty light pressure. And we're going to be doing, everything is going to be starting like with downward movements, right? Like you have lymph nodes in different parts of your body. Lymph is actually throughout the body, but the ones that we'll be working with is right around the collarbones in particular. So with that, I'm just going to suggest that we all just start. Maybe it's okay to have rings on actually for what we're doing. You could just sort of feel your collarbones and just feel free to just kind of lightly, I'm doing like this movement. I know you guys can't see it. And you could just kind of do it and release. Kind of like hold on to those collarbones. And we all have different bodies, so some of our collarbones just naturally stick out a little bit more. But I'm just going to kind of, this is like a warm up for those lymph nodes. It's saying, wake up, because I'm going to be sending some toxins your way. By the way, if like me, you get like a lot of like puffiness under your eyes or, blah, 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 this will all also help. So there's cosmetic effects, but I'm really going for just the relaxation. Good. And then we'll just kind of take our fingers behind the ears and just, again, light touch down to the collarbones. Behind the ears, light touch down to the collarbones. Just kind of everything we do, we're just going to do a few times. Good. And then we'll just take our fingers to sort of the center of the forehead And again, just very light touch, like kind of raking out towards the temple and then down towards the temple and then down. Just really as though what came to me was as though you love yourself, right? And if you don't quite feel that way, fake it till you make it, as they say in the 12-step programs, right? So just really gentle, loving movement here. Good, good. And then we're just gonna go, and we're just gonna like go upwards now. So you could, so I'm just gonna do it with one hand, but you could also do it with both hands. And we're just kind of lifting up all the way up. This could be great for headaches or tension in the forehead. And it's totally fine to go up by those eyebrows. I'm going to go back towards the center because this feels really good for me. I often have a lot of tension in my forehead. And we're just kind of lifting up. So this is the one where we're doing a slightly different direction. Good. Let's do eyes. So you could take any finger. We're going to come to the outer eyes. And with a light touch, we're going to go underneath the eyes to the inner eye. Come to the corner of your eyebrows and just, you can apply a little bit of pressure here. This is actually the bladder meridian in the Chinese system. And then we could just go through the brow line to the temple and then light touch down. So we could do that a few times, just, and you could use, some people suggest the ring finger, but whatever finger is easier for you. Underneath to the inner eye, little bit of pressure by the inner eyebrows, all the way to the outer eyebrows, and then down. Let's just do that one more time. And maybe play with different fingers. I'm going to do that myself. Good. And then we're just going to go in the opposite direction. So fingers to the inner eyes will go under towards the temples and then release that down. Fingers to the inner eyes under through the temple and down through the lymph nodes. And just one last time. Awesome. So I'm just going to show you this on one side, but we'll do it on both. So now I'm just going to take a finger. I actually want to take my middle finger, even though I know it's not a nice gesture. And we're going to come to the sides and just draw like a figure 8. And we could do that on both sides. So we're just, or infinity, just drawing a nice figure 8. By the way, if this hurts your shoulders, maybe just come and rest your elbows on something, rest your head on something. This is meant to be really a soft and gentle touch. Thanks to Nadia, I did it earlier on myself today and it felt great. Awesome. And then we're just going to do like just kind of a soft pinching. I'm just going to use these 3 fingers and we're just going to do a soft pinching under the eyes and then over the eyes. Just a few times. Doesn't really matter what direction I'm doing outward. Not aggressive at all with the skin. We're really just trying to wake things up and move out. This could be an area where we have a lot of puffiness as well, congestion. Okay, good. And then I'm gonna, for the next one, I'm hoping that you guys might already be feeling like a little tingling. we're going to go around the nose. So I'm just going to take my fingers and I'm just going to go all around my nose 3 times. Good. Actually, as long as we're here, I want to teach you an acupressure point. That's very helpful if you have a stuffed nose. Right above the nostrils, on the sides, you're going to feel a bone, and all of our anatomy is a little bit different. But if you press with actually a little bit of pressure in and up, it might be a little painful. Does anyone feel that? Yeah. So that's a great point if you're stuffed up, just to hold on to that. So let's just do this for 30 seconds before we move to the next thing. Maybe another couple of breaths. Awesome. And then we'll do something similar, same, but different. We'll go up and around, but this time go all the way up the bridge of the nose, over towards the temple, and just flush it down. Little bit of pressure as you go around the nose, up through the bridge of the nose, over, and then very softly down. Last time. Going around the nose, up to the bridge, to the temples, and just lightly descend. Okay, so now I'm just going to take a few fingers around. We're going to focus now on the mouth. And I'm just going to go around the mouth a few times. I'm really grateful for those of you who are, I'm grateful that for everyone who's here. And I'm also really especially grateful for those of you who have your videos on. I'm not trying to shame those of you that don't, but it's really helpful for me to at least see a few people. So I just want to acknowledge that and thank you. Okay. And then we're going to do that same thing, but we'll go up to the eyes and around. So we'll start just kind of around the mouth, go around it, up to the inner eye. You could pause here and then just take that to the temples and down. Feel free to add a little pressure as you're going around the mouth, and just one finger to the inner eye. Up and around. Last one, just around the mouth. Up to the inner eye. And we'll release it gently down. Okay, so for this next one, we're going to start now just on the jaw. And we're going to I'm going to hold my face to one side. And there's sort of like the chewing muscle that you can feel. And so we're just going to kind of with a light touch, open hand, I'm just going to go all the way up, kind of to the bridge of my nose, and then release it down. Diagonal, right? Coming up, and then real soft descent. Last time. Okay, and then I'm going to take it to the other side. So I'm going to hold this side, find that chewing muscle kind of coming up, and then a really soft touch down. Touch is so important. It almost immediately can have a really nice effect on the nervous system. And self-touch is really good. Good. So just kind of come through center. We're just going to do a few more. So let's go, for these nasal labia, you're going to take your fingers, they're going to be horizontal. And again, just like kind of what we did here, we're just going to rake out towards our ears and then flush it down. Out towards our ears And flush it down. Good. One last one. And flush it down. Okay. Jaw. So I'm gonna make kind of this shape. So I'll just show you what I'm doing first. I'm gonna go up my jawline, kind of starting from the center, but my thumb is gonna go underneath. And you could have a little bit more pressure here. So with my knuckles and my thumb underneath, I go up towards like that TMJ, right? And then I release. I'm just gonna do this a few times. Good, and then right where that TMJ is, so just kind of right by your ear, we're just gonna do just a little, with a little bit of pressure, just some gentle circles. Okay, and then just release, and you might want to like roll your fingers around or sort of just do something like that, right? Whatever would shake it out. Pause here for a moment. I'm going to close my eyes, but you don't have to. Just kind of notice what you're feeling, the sense of aliveness, there might be tingling, there might be a difference in temperature. And I'm not quite done with you just yet. I do want to get just a little bit into the neck muscles. So if you turn, I'm just turning my face to the right. When I do that, I can feel these muscles pop up in the side of my neck. Right behind it, I'll be able, is where I'm going to do just a little gentle massage. So does everyone feel when you turn this long line of ligaments that sort of pop up, and then you've got this, these are called the scalene muscles, are right behind it. And I'm literally, and this could be a place where you want to have a little moisturizer. I'm literally just gonna walk my fingers. I am applying, you could literally like move your fingers like this. You could also kind of hook in. And all along that line from just under my ears down, just behind the part that pops out, I'm just gonna give myself a little massage here. And for some of us, there might be a point, like for me, it's right here where I could feel some tension. And so I'm just gonna pause there and apply a little bit of pressure. If you have pain, often pain in these neck muscles can resonate in the shoulders or in the shoulder blades. So sometimes even though we feel pain in one part of the body, the source of it is another part of the body. It's the fascial system, connective tissue. Good. And then we'll just pause here. I'm going to go to the other side. And again, I'm looking for the part that pops out. And then I find this like kind of long band right behind it. I like to do it with the opposite hand, but I'm seeing some of you do it with the same side, which is awesome. So do what feels right for you. You could let your fingers do the walking. Does anyone remember that? I'm a child of the 70s. Or sort of glide down, especially if you have a little bit of oil or something like that on your skin, then you could have a more gliding. Good. And then let's just stop for a moment. I'm going to invite everyone to just notice how you're feeling again. If it's comfortable for you, you can, my recommendation is if you keep your eyes open, you find something to gaze at. I've got a really pretty flower right behind my computer, but you can also just close your eyes. You can also, if it helps, take one or both hands just over your heart. And we'll just take some deep breaths right here as though we're breathing in and out behind the hands, right where that heart space is. Just nice, easy, rhythmic breaths. Noticing what you've created in a pretty short time this afternoon. And I want to invite you to bring to mind someone who you respect or admire for the way that they taught you to care for yourself. And that care might have been teaching you how to balance a checkbook. It might have been doing a massage. It might have been teaching you how to put on a new tire when your tire blows, right? There's so many ways of doing self-care. So just bringing to mind that person. There might be some way that you want to express gratitude to them. Let's just take one more inhale wherever you are. And then especially if your eyes are closed, let me invite you to bring the chin gently down. If your hands were by your heart, you can release them. And just begin before you come right back to the screen. Look around the room, maybe notice the colors or the textures. There might be an object that also you really love, that's very meaningful for you. And then whenever you're ready, I have such curiosity about what everyone is looking at with such admiration. Whenever you're ready, just come back into the space that we've created together. So thank you so much. I feel like that should be called putting your best face forward. And I don't know if anyone has any questions or feedback.
Go ahead and unmute yourself if you have a question or a comment for our wonderful presenter today.
And thanks, Monica. I just saw you. Oh, thank you, Linda. Thanks, Salome. Yeah, I'll just look at all of you and stuff. Thanks, Christine.
All right, everyone. As always,
we didn't do the ears. Sheila's saying, what about the ear? I know we can do an entire, all the acupuncture points end at the ears. So there's auricular acupuncture. So there's all this stuff that we could totally do.
Okay,
next
so
time.
the next one in the ears. Acupressure in ears. I love this group so much. Anyway, okay, so next week, Dr. Kimberly Bear, who some of you may remember is the dentist that came and talked to us a few months ago, is going to be back. So bring your oral health questions for her. She was amazing, and she's probably going to do the same. And then we're going to be doing a mind-body practice about starts with a V, ends with a nerve. Next week, Victoria Karakcheva is going to be doing that. And that's about it, everybody. Have a beautiful weekend. I'm gonna head down to Charleston and then Beaufort to go have some fun. And I'll see you next week. Bye.
All right, see you next week.
Thank you,
Thank
Gail.
you.
Okay, bye-bye. Are